Yeah, that's good.
All right, let's go ahead and start grand round.
I mean, I'm not always, but
All right, we're going to get started. Phan's going to talk to us about managing childhood behaviors. I assume that he's sticking to childhood behaviors in childhood rather than adults. So, right ahead, Charlie.
Hey, thank you guys for coming today. Let me know if you can't hear me for whatever reason, okay? But my talk basically started as an idea back in September. For those that are kind of in the know about the Adrian Peterson story, you know. He's like a running back for the Minnesota Vikings. He abused his child with a switch or a tree branch, you know, and was subsequently suspended from the NFL. So, you know, pretty straightforward case. You know, reading the comments, you would think everyone would be like, oh, this guy needs to be, you know, away from the NFL. But a lot of the comments were actually the opposite. They're actually supporting him, saying, oh, it's just a man trying to discipline his kid. What's wrong with that? So that kind of sparked the idea of this grand rounds here. We'll talk about a lot of things. Disclosures, I have none. And the objectives today, identifying toxic stress, its multifactorial etiology, and its effect on multiple health systems. We're going to outline a little bit of the developmental stages that deal mainly with, you know, how children learn and develop and how discipline plays a role in that. Discuss techniques to manage childhood behavior. It's the bulk of the talk there, which is good for especially pediatricians that don't have children. A lot of times parents will come in and say, you know, my kid does this, how should I discipline him? So we'll give you guys ideas to talk about during the visit. And I'll list a couple of common behavioral issues that most parents experience, and to propose some protective factors that we've found through research and everything like that, that affect, you know, how a child grows up. So why care about discipline? Developing brains are exquisitely sensitive to the environment, and it all starts, you know, from day one here. Everything that the parent does, how it interacts with the child, affects brain development, and it affects the genome on what gets you know, transcribed and expressed. And all of that plays into the initial brain development of a kid. Again, it occurs at day one. So a lot of times, you know, a baby will come out, the parents will be like, okay, I don't necessarily need to play with him that much, all he does is sleep. But it's very important that you stress to the families that everything that with brain development starts at day one. So, you know, reading to the child, things like that. And the brain development then again leads to behavior, like how the child reacts later on to things, whether it's adaptive or healthy coping skills versus like maladaptive or unhealthy coping skills or externalization. And that all plays back into the experience again and becomes kind of a vicious cycle if you don't correct it. And there's a lot of new data that we've known about for a while, but especially in the past 10 years on toxic stress and how childhood experiences, especially adverse ones, have an effect on not just how the child learns growing up, but the general well-being and adult health. You know, things like mental illness, substance abuse later on, things like that are all expressed. So things that play into toxic stress, things that, you know, affect the child, abuse, neglect, natural disasters, and then chronic disease, all that affects the child, how they grow up. And parental stressors, things that the parent, you know, brings to the table, like substance abuse, domestic violence, divorce, poverty, and all that plays into this physiologic stress in childhood. Not all stress is bad. There's actually, you know, positive stress. Usually it's brief, you know, like leaving the child in the crib while the mom goes to make formula. It's a little bit stressful for the kid, mild severity, but usually, you know, kids innately have a little bit of buffering. So it's sufficient for them to return to the baseline of the effect of stress on the system. Tolerable stress, such as, you know, maybe dropping the kid off at school, separation anxiety, it's a little bit longer in duration, a little bit more severe in severity. But, you know, children, if they're raised correctly and you talk to them, a lot of times their buffering is sufficient to kind of return their stress response system back to the baseline. This is where a lot of the research for the past 10 years has been going on, is this toxic stress. How much or how sustained is the stress that causes issues with development? And how severe does it have to be? Does it have to be sexual abuse, physical abuse? And a lot of times it's overwhelming for not just adults, but in kids as well, and they have no buffering capacity to return to the baseline here. So then they start having changes in the baseline. There's been studies on rats and adults that show, amygdala hypertrophy and how stress becomes toxic to the hippocampus and prefrontal cortex, and how it causes changes later on in life. We'll talk a little bit at the end of the talk on sources of resilience, social emotional supports, things that kind of help buffer the child from some of these stressors here, and then vulnerabilities. I'll have a slide on that. Delays in development, limited social support, and how that plays a part into toxic stress. So you can argue that discipline is going to be, one of the main factors that creates that environment that the child grows in, whether it's nurturing, good discipline, or bad discipline, stressful time for the kid. This is from the Gershoff report. She's a developmental psychologist at UT Austin, but this was done in 2008. She basically defines discipline, or physical discipline, as the use of physical force with the intention of causing the child to experience bodily pain or discomfort, so to correct or punish the child's behavior. From her studies, as well as others, shows that physical punishment can vary from an open hand to the butt, hitting the child, slapping across the face, or other forms of punishment beyond the scope of customary discipline actions. And I thought this number was staggering right here. This is 1999, but a large survey showed that 94% of toddlers were physically disciplined in the past year. That's gotten a little better, but it's still a very, very high number today. In 2001, there was actually a global initiative to end corporal punishment for all children. So this is basically like changing the laws to make it illegal for parents to physically discipline their child. As you can see, the green is where it's prohibited in all settings, Eastern Europe, South America. And you can see in the United States, North America, it's still prohibited in some settings. And that changes from state to state. Some states say you can leave a mark, but not up to two or 3 hours. It's not considered child abuse. Or if you leave a mark, then it's automatically considered child abuse. So just depending on what state you go to, it's good to look up the laws to find child abuse there. And like I said, the attitudes are improving about physical punishment in all races except for African Americans. For some reason, it's just in their culture where they feel like corporal punishment or physical punishment is accepted. But a lot of studies have shown that despite the cultural acceptance of physical punishment, the detrimental effects of discipline are still the same long-term with health and everything like that. And it's not just a human rights issue, it's a cost issue as well. In the United States, it's been estimated that the total cost of child maltreatment, including like health care, child welfare, criminal justice, things like that, is $124 billion a year. So that's a lot of money that we can do with just educating the parents on better discipline techniques. So discipline is the second most important gift that a parent provides for the child. Of course, loving the child and providing for them is the number one thing. And that's very easy for some parents to do if they're not overly stressed. Kids, babies are really cute, so a lot of times the mothers will cuddle with them and give them affection and things like that. But discipline is probably the hardest for parents to provide sometimes, especially if it's outrageous externalization behaviors like acting out and things like that. Another thing too that I think makes discipline hard for parents is, one, they don't have coping mechanisms or don't know how to discipline their children other than how they were raised. And the other thing is discipline is very deceptive, it's like very difficult. And a lot of parents, I know it was for me, like when I had my first kid, I thought it was going to be a lot easier than what it is now. But once you have a kid, you'll find out that it's actually very difficult. So this is, kind of my perception, how easy it would be. You feed the kid, soothe him, he sleeps, it's like a scene from heaven or something like that, or the movies. Everything's easy. But a lot of times it's more like this, the child's just kicking you in the face, you get no sleep, and it's just very difficult. And then this happens a lot, kids fight, they cry, some kids cry more than others, and as soon as he gets better, Mason starts crying. So then it's a constant cycle, always trying to see these kids, and all you really want is for them to get along. And sometimes this is, very special, you hold on to that moment, but for some parents, especially ones with a lot of children, it's just a constant crying and having to take care of children, so it becomes stressful for parents. What I would, stress to the mothers, especially new mothers, is explain where the child is in development, and that sometimes helps the child or the parent be a little more understanding. So we'll talk a little bit about the developmental stages at this point. Soothing, self-soothing. So babies will be fussy, want to be rocked, or talk to them gently. They want the blanket. Those are ways parents can help soothe the child in the initial first 6 months. And children will also try to calm themselves down. They cry in the middle of the night a lot of times. They'll stick their thumb in their mouth and go back to sleep. It's their way of taking care of their own emotions and their way of self-disciplining themselves. And parents need to learn a pattern of connecting and disconnecting. Like sometimes you need to allow the baby to calm and soothe himself to help him control his impulses later on. So because if the parents always step in, as soon as the parents leave, sometimes it's hard for other caregivers that aren't paying as much attention for the baby, and that creates like a stressful environment for the child as well. After 6 months or so, the child's sitting up, crawling. This becomes, the perfect time for parental discipline. And fortunately, discipline at this time is mainly just keeping the kids safe. So, putting up chemicals, removing sharp objects, things like that. It's the main thing here. And then the child will be pointing, grabbing things. Make sure, you don't put anything close to where they can grab it and hurt themselves. So discipline at this age is still fairly simple. About 9 to 12 months, the toddler can read parents' faces. And a lot of times they'll try to test these boundaries. Like Oliver will try to climb on the fireplace. We'll tell him no, and he'll get down, and they'll try to climb back up. So kids at this age, they're stuck on like little impulses. They don't really know cause and effects. Like, if I climb up on this and fall off, I don't know. They don't necessarily know that it's going to hurt the first time. So a lot of times this is where the parents need to step in and say, no, that's hot, or that's really high. You don't need to get on that. Parents at this point need to decide on some rules and apply them consistently. Kids are very smart, so if you tell them no a couple times and the third time you let them do it, they're going to know that, okay, I just need to keep saying, keep doing it, and then after the third time, fourth time, my parents will just give in and let me do it. So it's very important that the parents apply the rules consistently. And then parents don't need to get frustrated when the kids don't listen and attempt to, do the, whatever activity or behavior it is that's obnoxious at that time. So at 12 to 14 months, most kids are walking at this time. It becomes exponentially harder, I think, once kids start walking. They can get into things. You put up a gate, they find a way to like climb over it or ram it down like Mason did. So it's a lot harder once kids reach this age group here. And a lot of times temper tantrums can start here. They're crying, when you don't give them what they want, they start fussing. But again, it's good to allow the child to kind of calm themselves down and kind of teach them impulse control later on. At 24 months, most children start learning a little bit about cause and effect, but they lack judgment. So they know what they're doing, they know that it's bad, but sometimes they don't know how bad it is. So this is where parents need to step in as well. Impulses, again, take control, and despite knowing about cause and effect, they still do it most of the time because the impulses are stronger than the actual, knowledge that they have. Parental vigilance is always important, and there needs to be a balance at this point in helping the child learn how to control himself. And it'll help him later on in life as well. Because at the end of the day, that's what the goal is, You can't be with the child forever. So teaching him how to control himself is the ultimate goal there. And these are things that, children and adults deal with every day. They try to learn, more so in children. They try to, experience a lot of emotions and intense feelings. Like frustration, anger, disappointment. And this is where the parents can, kind of help them recognize the feeling, what triggers it, and, kind of teach them how to control that feeling the next time. Empathy is basically, where you're able to understand another person's feelings and experience it as your own. Some people, never learn this. Some doctors, strive to learn it, every day that they practice. So it's something that you can start early on, and hopefully they build on it build a foundation for later on. Moral development is kind of the same, you know, learning the rules, how to interact in society. That's where discipline comes in as well. And then for a child to love other people, they need to learn how to love themselves first. So building a self-esteem, teaching the child how to love themselves is, you know, part of discipline as well. And some points to always put in the back of the parents' minds is children are not small or young adults. A lot of times, parents get frustrated because they try to reason with like a little 4-year-old or 5-year-old, and they say, you know, why aren't you listening? It's because children's brains aren't developed like, you know, you and I. It's not that far yet. So a lot of times, you know, reminding the parents that, you know, it's just a child. Kids will be kids, and to have some patience as they learn how to deal with a lot of their emotions. And then 2 key mistakes in parenting that parents do a lot is talking too much, especially when the child's having a tantrum or something, trying to talk to them or talk them down. A lot of times that sometimes aggravates it more. And then having too much emotion. It kind of builds onto talking too much because the parents get frustrated and they put in their own emotion. It kind of feeds down to the child, whether it's like anxiety or violence or anything like that. It kind of just throws things out of proportion. So we'll talk about behavioral techniques that you can try or can recommend to parents. Things that, you know, tend to work, are worth trying. And then we'll talk some techniques that, you know, are sometimes useful, you can try it, but haven't been proven with data and everything to work. And then we'll talk about things that are not helpful in disciplining a child. So warnings are good. It helps the child anticipate change or stress, and it gives the child an opportunity to control his own mood. So telling them, okay, we have 5 more minutes and then we have to stop playing, or we got to go home after 5 minutes. It kind of helps the child anticipate the change and they deal with it a little bit better. And it doesn't work very well if the parents are inconsistent. Like if you give them 5 minutes and then they say, no, I want to stay, and you give them another 5 minutes, you know, the warnings don't really help very well. And sometimes the child is too engaged or resistant in what they're doing. Like if they're having a lot of fun, sometimes these warnings aren't enough, and sometimes you need to remove the child as well. So silence can be a very powerful tool as well, especially if the child's a little bit older. But it's always necessary to debrief the child and explain why you have to give the silent treatment. For example, like saying, I needed to walk away so you can control yourself or regain or regather yourself. And say that I'm not leaving you or neglecting you, it's just I'm letting you try to control your own emotions. If you use it a lot, it can be seen as an emotional withdrawal for the child or neglect. So it's things to try, you know, only occasionally, but it has been, you know, proven to work if used correctly. So timeouts, there's a lot of data on this. So basically how timeouts work is it slows the child down to recollect himself. Basically you send the child to, you know, the room, an isolated spot like on the couch or in the corner. And timeouts should last as long as it takes for the child to, you know, regather himself. A common rule that people use is a minute for each year of age that they have. So if the child's 2, you can give them timeout for 2 minutes, or 3 years, 3 minutes. And always let them know that you're close by, but again, avoid contact during the timeout period. Because sometimes if the parents try to talk and calm them down, it makes it more, you know, stressful for the child. And use timeouts firmly, no arguing, you know. If you're going to timeout, put them in timeout, and just kind of walk away and make sure they're safe. Usually works when you're more consistent. And then child, once they're done with the timeout, don't go putting them back in the situation that made them stressful the first time. Sometimes it's a parent's mistake, like, okay, you know, they're fighting with their little brother or something for some toy, and you put them back in that situation. It doesn't give, kind of sets the child up for failure sometimes. But, you know, if you do want to try it, if you think he's learned how to control himself, you can give him a chance to, you know, control his emotions the next time it happens. So it's kind of just, you know, trial and error. And then giving the parents a chance to calm down, it gives the parents a chance to calm down as well. Sometimes parents get a little angry, want to spank the child, but putting them in timeout kind of helps decrease everyone's anxiety and stress level. So it gives the parents a chance to calm down and decide on the punishment or solution to the problem. And then if all else fails, it creates like a routine, something the child can know that's going to happen, you know, if he's bad or doesn't listen. But occasionally it does lose its impact if used too often. This is another method that, you know, made famous by Dr. Thomas Phelan. He's a clinical psychologist like in Chicago. It's like 1, 2, 3 magic or counting 1, 2, 3. You might have heard like different variations of it. But it's good for children, 2 through 12 years of age, especially once they've learned, cause and effect and things like that. But the children need to be oriented to the system. Basically how it works is if they're doing something obnoxious, you tell them to stop, like if it's whining or messing with their brother, you count 1. Give them a couple seconds to correct themselves. If they continue to fight or be whiny or anything, then you count 2. You wait a couple more seconds, and then you go to 3, and then take 5. Take 5 means like how much time they're going to spend in timeout. So if they're 2 or something, say take 2 or take 3 if they're 3. But basically, it's a way of combining the warnings in addition to timeouts. It gives the child a little bit of warning to change his behavior, and if he doesn't change, then he knows he's going to go to timeout. Again, don't forget about safety. So if Mason's about to stab Oliver with a scissors or something, of course you don't count them. You just run up and grab the scissors. A lot of that's common sense, but some people don't have that. So when is it good to count? The whining, tantrums, counting will help. And especially if they have tantrums, try not to put too much emotion into it. So just say 1, just kind of look the other way, or so they can't read your face, or so you don't look so anxious, or increase their stress level. And then 2, and then put them in timeout if they need it. Sibling rivalry, it works really well. And then other obnoxious behaviors as they grow up, like teasing and things like that. It's very helpful. It doesn't really help, however, for these start behaviors. Basically what Dr. Phelan describes as behaviors where they start doing something. So like potty training, going to bed, getting up for school, doing homework, things like that. You can't really force a child to empty your bladder, like go sit down or you're gonna get time out. It doesn't work like that. It usually becomes more stressful for the child if you start using the counting method for that. And then another situation is if they have anxiety, whether it's like social or like separation anxiety, it's not good to count, because a lot of times the kids can't control their anxious behavior. It's just the feeling that they have when they're away from their parents or in social situations. So it's not good to discipline or put them in timeout for that. Another method that sometimes helps is making them redo something the right way. For example, if they put the toys in the wrong box, or you tell them to clean up and they just kick their toys around into another spot. You kind of need to do it for them, show them how it's done, and then it helps the child learn confidence in his own effectiveness. Basically, the next time he does it right, he'll feel better and more confident about it. And it's kind of like a stepwise approach. The more they do it, the better they're going to get at it. And sometimes parents try to, get them to, clean up your room, but a lot of times it's too daunting for the child. It's too much, information or too much for them to do. So breaking them down will help, like clean this section of the floor or clean this side of the room, clean up your blocks first and then clean up your cars or something like that. Giving them time to do it too will help. And it kind of teaches children about, second chances and how to, make things right. Planning is similar to warnings. It gives the child a chance to anticipate stressful situation or a problem, and then helps the child plan, how they're going to handle that situation. Teaches the child to be proactive in controlling his own emotions, and can help a lot. This helps a lot in like supermarket visits and things like that. Being like, okay, I know you're going to pass by the candy and you're going to want something, but we can't get it for you every time. If you're good, then maybe I'll get something for you. It kind of helps the child form in his mind, like, okay, if I'm good, if I do something good, then I may get something. Versus telling the child right away, like, oh no, you can't have candy, and then they just freak out and everyone's screaming and parents are frustrated and everything like that. It gives them a chance to problem solve and decrease the stress later on. So taking away toys, taking away privileges, things like that, sometimes helpful. There's data, both ways on these things. So removing toys, removing video games, sometimes helps stop the behavior, but a lot of times it makes the behavior more desirable or alluring. So, you use this with a little bit of caution. And try to use a toy that the child is deeply attached to, especially like a little child. Sometimes it can be very, very disturbing for the child, and it makes them more angry then actually helps them stop their behavior. And then this is optional, but I think it's a very good method to use. It's telling the child why the toy was removed, how long you're going to keep it away from them, and then how to get it back. Like, it teaches the child how to apologize or make reparations for their actions. So this is very good for children as they get older, because they can learn, like, okay, if I do this, I'll get the toy back. So canceling or postponing activities, canceling a trip to the park or with friends, play date. And it's good for children once they learn cause and effect. So, you don't want to put your clothes on, we're not going to have time to go to grandma's, or we're not going to have time to play at Chick-fil-A or something like that. But it shouldn't be used often enough to decrease socialization. Just because, social events as human beings are very important in how a child learns, like how they speak, how they play with others. So don't use it too much, because then, you start having adverse effects on how the child develops. And it doesn't work well if the events are unrelated. So, saying, oh, you're not going to be able to go skiing, in 3 months if you don't do this. Sometimes it doesn't have enough of an effect because it's the actual prize or the event is too far away. So keeping something very close to the actual event will help when you're taking it away or canceling it. And try to choose an activity that causes immediate impact, kind of like the last point that I said. So this was actually very interesting when I was doing my grand rounds together. This is like the Henderson family. It was on CNN and probably other news networks, but it's a family that was in Utah. The children were, very disobedient, had feelings of entitlement, not listening, very like spoiled kids from what I got from the article. But basically what the parents did is they decided to cancel Christmas. They still did like the family Christmas where they went to church and things like that, but no commercial Christmas. So like no toys. They used the money on the gifts that they were going to make for toys or get for the toys to do service projects, clothing drives for typhoon victims, and just basically stuff around the community, like soup kitchens and things like that. And it basically, put Christmas into perspective for the family. And the parents are actually really glad that they did this, because the children were a lot more, obedient and actually listened a lot more. So sometimes it takes a threat as big as canceling Christmas to actually work, but canceling Christmas every year is probably not going to work. So, it's not good to do that. Ignoring misbehavior. This one's a little tricky, but basically it's useful when a child is reprimanded so much that he stops listening. Like all you do is nag, nag, nag. So then the child kind of becomes like desensitized to the punishment. So what you can do is kind of ignore the minor behaviors, and it helps kind of resensitize the child to the punishment. So the child resets their system to where they say, okay, I can do this if I jump on the couch, but if I jump off the couch, I'm going to get punished. So it kind of helps do that. Sometimes it can cause confusion, so the data's not either way that whether this works or not. But and it also increases frequency of minor offenses sometimes. So this is kind of tricky for parents to use, but good parents can sometimes use this as a way of resensitizing the child. And leaving the scene, this is for the parent. It's the opposite of a timeout, where the parent leaves the scene, and they need to make sure the child's in a safe environment, first off. It kind of helps them calm down, realize that whatever they're doing is bad and the parents need to go away. And it's good to, debrief the child when you come back and say, okay, you're acting very obnoxious, I need you to walk away, to calm down, and that way it gives you a chance to, take care of your own emotions and gets them to be a little bit more responsible in controlling their own emotions. Usually it's very good for like a mature child, 6, 7, or someone that's getting more mature as they're learning how to control themselves. And debriefing will help clearly portray that this isn't neglect, like you're not leaving the child for long periods of time because they're acting bad. Sometimes that causes externalizing behaviors as well. Extra chores are good. Sometimes if used in the right setting. Basically, you get them to, they break something, you get them to do wash the dishes extra time, check out the trash an extra time, like that week or something, as a payback for a broken object. It creates an opportunity for the child to make amends for themselves. Basically, okay, I made a mistake, I need to work it off, and then everything will be okay. So, and it helps to commend and praise the child later on too. It can make the chores look like punishment, however, so try not to use it too much because, children should be helping up around the house, with chores and things like that. So, and try not to use it too much. And this is kind of the same idea, taking away allowance if a child has allowance, especially if they break something or need to pay someone back something for breaking, like a dish or some toy. And it doesn't really help with the transgression in the past, but it may help prevent the, future problems or how they act next time they're playing with a child and they want to break something. Okay, so next is things that don't really help, contrary to what people believe. Basically, it's spanking or corporal punishment. It works by fear and physical pain. The child's unlikely to remember the reason for spanking a lot of times, only that, it was very painful and how the dad, disciplined them. I think the main thing that makes it bad is it teaches a child that violence is the way to settle things. It might work when the child's 2, 3, 4, but as they get bigger, 16, 17, they tend to sometimes fight back. So sometimes that creates like another issue with the family. It increases the rates of domestic violence. People are going to jail because the mom is frustrated with a 17-year-old. He hits the dad back, so that both people are in jail. So it just creates more problems later on. So this is what you can tell parents that still believe in this, and you can only educate them on the data that's out there. Whether they choose to follow your instructions is up to them, and it predisposes some children to anxiety-related problems. So this is a study that I found looking at anxiety sensitivity. Basically, it's anxiety sensitivity is the fear of anxiety-related body sensations. So these people with high anxiety sensitivity view like benign sensations as adverse. So these people tend to have like this vicious cycle of fear, bringing on more fear and creating more anxiety. So like internalizing behaviors. It was a study of 191 families with 255 children aged 6 to 12. And they used a lot of these children anxiety sensitivity index, basically like surveys, Alabama parenting questionnaire for the parent and the child, and uses this RCADS for measuring the child anxiety and depression scale. A lot of it was Caucasian families, some African Americans, some Asians, and Hispanics. Basically what they found is corporal punishment is positively associated with child anxiety sensitivity. And it was like a dosed response too. So the more they were corporally punished, the more positive associated it was to anxiety sensitivity. They did find, however, the good thing is that positive parenting moderated this anxiety sensitivity in the child. So positive parenting is basically commending the child when they do something right, and helps the child like in an anxious situation such as, like saying, hey Johnny, you did really good in that play today. Even though they were anxious, they still view it as a positive experience, like, oh, I still did good even though I was anxious. So it kind of puts like a positive spin on the anxiety inducing situation. It helps the child kind of form like this coping mechanism later on. And they found that girls were more sensitive to parental anxiety sensitivity. So, if the child is the parent's very anxious, the girls tended to have more anxiety sensitivity problems later on, or internalization later on. But, this study is cross-sectional, and it only shows association, so you can't really draw causality out of this thing. People that are parents that received corporal punishment are more likely to use the same method with their child. This goes back to the first point. Discipline is very difficult, so a lot of times when the parent's stressed and they don't have enough coping mechanisms or support, they revert back to like how they were raised. And if they grew up in a house that used corporal punishment, of course that's what they're going to use. So teaching the mom that will help. Like try to break that cycle, because if you yell at your child or physically punish your child, they're just going to put them at increased risk of using it later on with their child. And some risk factors that they found in this study and other studies is child-related risk factors of physical punishment in families. There's physical, mental, developmental disabilities. Those children are more likely to be physically abused. If it's low-income family, large number of children, usually increased stress in the family. And then if there's domestic abuse, or if it's a young or single parent, low education, drug abuse, mental health. And we'll revisit this later on as well. Another method that doesn't work is shame and humiliation. Shame, can make the child believe that they're really bad and kind of creates like a bad cycle or self-fulfilling prophecy for the child. It's good. It may teach a child to hide off or put off the behavior just so they're not caught. It kind of creates this mentality where, okay, if I do something bad, don't get caught because, it's going to be humiliating for me. Outbursts or yelling is a parental issue. It's their way of coping with stressful situation. A lot of times it just frightens the child, but unlikely to learn from whatever the parent is yelling at or yelling for. And children tend to imitate their parents. So, children that get yelled at as kids will likely become yellers later on. So, and that's very frustrating if you have a teenager that's yelling at you all the time or yelling back at you. And surprisingly, a lot of data shows that children are more likely to stop and listen when parents suddenly lower their voices and speak in a whisper. They don't really know why that's the case, but I guess it's just a change in discipline technique that the parent uses. So it's just a little bit more, okay, I need to pay attention because this is new or different. What's going on? Soap mouthwash. This was used a lot, I guess, when I was little. I don't know if parents still use this now, but a lot of times the behavior is stopped by the time the parents got into the soap. It's basically where the parent washes the mouth, like, oh, you said something bad, let me wash your mouth down. There's no nutritional benefit. Sometimes if the child's real small, it causes confusion for the child on what I can eat, what I can't eat. And a lot of times it just causes resentment. The child doesn't learn anything from it, so there's no point doing it. And it just causes resentment later on. Withholding or giving extra food if the child does well. It's not really a good technique to use because food is a necessity. It's something that the child should get provided for them all the time. It basically symbolizes love for the child. So you never want to do any discipline techniques that seems like you're loving the child less or giving extra love for good behavior. Meal times are also a social family bonding moment. So excluding the child from it kind of hurts them later on, especially if they continue to be bad and you don't feed them for a while. And it turns eating into a stressful time for the child. And most children are very smart, so they may use that as a method of retaliation later on to say not eat, to punish my parents for not giving me food for last Saturday or something like that. Early bedtime, kind of the same thing. Most children are already adverse to going to sleep and taking naps and stuff like that. So it just increases the stress for the child next time that you put them to sleep. And it's difficult to enforce, like what are you going to do, strap the child down and cover their face? It's kind of hard to force them to go to bed other than just put them in their room and things like that. So it doesn't really help. And the ultimate stressor for the child is just abandonment. Like this is different from, the parent leaving the scene. This is the parent leaving the child for whatever reason, like say leaving the house, leaving the child by himself or with someone else just to get away. It can cause poor self-esteem. The child doesn't know why they're not being loved. It causes insecurity and damages the parent-child relationship, which should be, the most important thing growing up for these children. Resentment causes resentment and hatred, and leads to a lot of negative behavior, whether it's internalizing behaviors such as anxiety, depression, or attention-seeking behavior, externalization, things like drug abuse, truancy, things like that. So here we'll talk about common behavioral issues, and I'm running out of time, so I might go through a little bit faster or skip some slides, okay? So often no trigger will be found. This is something to tell the parent. So a lot of times they'll try to, ask the child like, what's wrong? And all that the child is, feeling at that time is like frustration, whether it's like rage or not getting what they want. And a lot of times they can't verbalize it, especially if they're younger. So tell the parents to just leave them alone, allow them to control their own emotions. A lot of times that works better than trying to figure out, what the problem is. When the tantrum is through though, you can go hug the child, let them know that, everything's okay. I know you were frustrated, but this is how you should handle it next time. creates like a learning opportunity for the child. Tantrums after 5 years old are prolonged for more than 20 or 30 minutes may have an underlying issue. So sometimes, that requires referral to a specialist or psychologist for that. Lying, all children lie. This is like universal. There's a lot of data that shows in 4-year-olds, 90% of 4-year-olds are caught lying at some time. And it just progressively gets worse sometimes. So children lie because they're learning the world can't be how they want it to be. So they try to change it. The other day, I guess, like I changed the station of music, and Mason goes, "Hey, Daddy, Oliver doesn't like that song. Turn it back to the Frozen soundtrack." So he likes Frozen, so I had to change it back to the CD for him. But kids will lie, even though it's like cute sometimes, just to change the way the world is, around them. So, and he might lie because he knows he's done something wrong, but doesn't want to face the consequences of it. So how you can prevent them from lying? I mean, there's no universal method, because some people will never learn not to lie. But parents can help by acknowledging the child's lie, like, okay, I know that's not true, but try to use a calm approach, because then that will eliminate fear of punishment as a reason for lying in the future. So next time, hopefully they won't be hiding it from you when they lie. And then if you make them real guilty, a lot of times it promotes further lying as well. So, and let them know that it's never too late to make up for a lie. So these 3 things can kind of help curbside a lot of lying. But some children, are chronic liars and may need like special counseling, like in the future, especially if it's like a chronic process. Okay, and this is another thing that's unavoidable, especially when you have 2 kids. But all children fight, and parents are likely to take this too seriously. But it's unavoidable. Just let the parents know that the child will learn how to interact with each other. So there's no way you can really stop it. Just teach them, how to walk in calmly, survey the situation, and remove any dangerous objects that they might hit each other with. And a lot of times, letting the child or children work it out on their own helps them build this emotional competence, or control their own emotions on their own. And the counting method usually works really well for this. So it also gives you an opportunity to teach the older child an alternative to problem solve. So when Oliver messes with Mason's toy trains or something like that, I've taught him to give your brother some train to play with, and that way it will distract him from messing with you. So now, like whenever Oliver's running towards the train table, like Mason will run and grab a toy and give it to him, and he'll run off. And then he sees that it works, and the next time it kind of helps share and like help him solve the problem before it actually gets worse, the fighting and stuff. And then this is very important as well. So parents are spending more time with the child. Sometimes that causes a little bit of stress for the other child. So make sure you spend equal time with both children separately, so that way they know that that's not the reason that they're fighting. And then it's good to set limits and consequences there. Okay. So we'll skip ahead to protective factors in parenting for the sake of time. This is a risk factors for corporal punishment, physical abuse. We went through this earlier, but physical, developmental disabilities, low-income families, large number of children, and there's a lot of data that shows like the way the child is victimized or punished determines how much depression or anxiety they have later on. So if it's sexual abuse plus physical abuse plus neglect, those kids tend to do all worse than a child that's just physically abused all the time. So try to ask parents if the child's getting physically abused, if they do any other kind of abuse, because that'll kind of like let you know where they're at on this risk factor scale. So this is a study or a paper that used data from the Fragile Families and Child Wellbeing Study. It was like a longitudinal birth cohort study from 98 to 2000, basically in 20 big cities. It was done by Princeton and Columbia. But basically it interviewed families at age 1 of the child, 3 of the child, 5, and 9 of the child. And basically they asked, okay, did the parent spank or physically abuse the child in the past month? And if so, how many times in the past week? If it was done for more than twice a week, then it was considered a high frequency where these waves are. So they also looked at externalizing behaviors in children. Basically, they use this like child behavior checklist, and it basically asks like 60 questions on whether the child is, truant, does drugs at age 9, or fights a lot, gets trouble in school, and that's measured like on this side. So, and they looked at the risk factors that we looked at on the previous slide. So 15 risk factors that they looked at, like similar to the ones on the previous slide: drug abuse, incarceration, little or no prenatal care, low income families, things like that. And if they had 6 or more risks, they were considered high risk versus low risk families that didn't have many risk factors there. So basically, externalizing behaviors, even if you don't spank your child and you're low risk, a lot of children have some kind of baseline externalizing behavior. But the more risk factors you have, it shows that it increases here and here. And 2 or more waves, 1 and 3 and 5, if you're spanked all 3 times or 2 of those times, and you're high risk, it shows like an amplified effect of how much externalizing behavior the child is going to exhibit at age 9. So these are the risk factors that I think we should focus on, especially when we're talking to parents, and try to, decrease, or this is the patient population that we need to make the most education for, the most lecturing on changing the way they discipline their kids. Just because, there's no way to predict how high this is going to go, but it does show that there is an amplified effect when you have these risk factors as well. Some protective factors for children that are physically abused or have violent events during childhood. This is a good study. It's 2014 in child abuse and neglect, but it showed amongst like college students that filled out these surveys, an average of all these students showed that they had like 9 adverse events or violent events growing up. So that's the average of them. But things that protected them later on with how they react to the world and how they interact in the world, how successful they are. These are 3 of the main things that they found. Spirituality was actually a very good predictor of whether they're going to do well. Connection to a higher being, if they feel like they're blessed. This tended to be more protective of, even though they were abused in the past, of them becoming like a good person. Emotional intelligence, basically it's understanding your emotions, differentiating between emotions and recognizing how emotions affect others. This is what a lot of psychologists deem as like emotional competence. People that develop this early on tend to have more or better coping mechanisms, tend to show more resiliency when they're exposed to stressful situations. And the techniques that they use in establishing emotional competence is a lot of times what they use in post-traumatic stress. A lot of psychologists use these kinds of methods to try to get them to understand their emotion, how they can control their emotions, and how they react to it. And social support, from friends and family showed a good protective factor in these kids. But surprisingly, in this patient population, which is college students, it didn't show that family support was found to be protective. There's data that shows that family support is protective in some studies. So they were thinking it's probably from these kids being college-age students, having more importance, or feeling like being accepted by their friends or their peers are more important to them. And if you're abused by your family, it's more likely that you're not going to take their support as protective later on. So that was some things that they discussed about there. So this one is one of the last ones. This was a randomized controlled trial involving 112 families that were followed by CPS. Basically, they put these families into the attachment and behavioral catch-up or control intervention group. Basically, the ABC group here was designed to help the families engage in synchronous interactions with their children, basically teach them how to interact with their child and read their emotions and things, provide nurturing care, and to avoid frightening behavior. This was 10 sessions where they were coached out of a manual, and they had like a parent coach that was there if they needed a little bit of guidance or help. The control intervention was this developmental education for families. It's like a proven interaction designed to improve like motor and cognitive and language skills in other trials that were used in the past. It shows in previous studies that the control intervention or this developmental education for families program helps enhance intellectual function in these families. So the researchers basically used a tool task to determine whether the child, improves from whatever treatment they got. So this tool task is basically a toy placed in a plexiglass and the 3 tools that they can use to get that toy. The first task was very easy, the child could do it on their own, and then the 2 other tasks, or the third task, was intended for the parent to help the child. So all this was recorded and then scored on this revised manual for mother variables and tool task, and then this 6-point anger scale and 7-point anger scale. Basically what they found is children from the ABC group showed lower levels of negative affect expression compared to controls. Basically, if they were stressed out, they were less likely to show like frustration or stress on their faces. And the ABC group displayed like lower levels of anger and sadness whenever they couldn't get the toy, or the parents helped them and they still couldn't get it. So again, this adds to previous studies that show that regulating negative affect in children is associated with less externalizing behaviors later on. So if they're able to control their emotions, form this emotional competence, later on they're less likely to be abuse drugs and fights and things like that. Okay. So summary slide. Toxic stress is real. There's a lot of data that's going on that will kind of help us determine later on like what risk factors are, what we can do to help prevent toxic stress. And the goal is not to identify at-risk parents, but to teach them better discipline techniques to kind of stop the cycle from day one. So even on your first initial visit, you can teach them some of these methods that they can use later on, especially if they don't come back to see you. And then good positive parenting helps the child face the future, forms this like emotional competence, and basically helps them become healthier adults later on. Okay, that's all I have, guys. Just references. Sorry I didn't leave much time for you guys. I wanted to leave a little bit of time to ask like the parents or people that use different techniques or discipline methods on what works for them. Anything extra that I didn't put in here that you felt like worked? Any comments on the top? Okay. Thank you, everyone.
John.
Let me just mention that drugs, including food additives now and then, have been alleged to have a role in malbehavior in children, and that's often not recognized unless you question for it. And then there's always the, Munchausen syndrome, where a parent is actually doing things or giving drugs in order for secondary gain. And that can be very, very subtle unless one is attuned to it.
I think that, Charlie, this is a great presentation. I think that you incorporated a number of things that anybody who does general pediatrics really needs to understand these principles, and I think as you provide anticipatory guidance to your families, making them aware of these principles and what to expect in different age groups is really important, because I think one of the key problems is expecting the kind of behavior that an adult might have in response to an intervention from a child who's 1.5 or 2 years of age, when that's not possible. And that kind of often leads to this inadequate or inappropriate interventions. And so I think it's really important, and I think you elucidated a number of the principles that you really have to follow, and I think it's a really excellent grand round. So any other comments? Any personal experiences with young children? I think obviously the goal is to, as a parent, stay away from losing your temper or getting emotionally involved so that you can apply these principles without losing it. And that's what often happens sometimes, and I think all of us are victims of that because our children are often very good at learning how to press the right button. And so I think it's really important that you're educating people to understand that, because kids are pretty smart and they do learn how to manipulate, and I think that part of your job is to control that without getting emotionally involved. So I think that's really important. All right, other comments?
I think you might want to stress to the parents too to make sure that everyone who is involved in taking care of the child is on the same business plan. That's very important to make sure that you're all on the same board. Because if you have 3 different caretakers and 3 different types, it can actually lead to more disruption in the house. So
Consistency,
That's a really good point. Consistency is really important. Yeah. Yep.
Thanks, everyone.
All right. Thank you, Charlie.